All right, so we are in Jackson Heights right now. Had to make a little emergency stop, which unfortunately means with the recording of this video, I won't be doing the Russian poetry tomorrow, but I'll be doing it pretty soon anyway, so at least you have something extra in the meantime. Today what I want to talk about is coronavirus, specifically long COVID, some what I perceive to be Democratic Party, Republican failures on this front, the fact that COVID is just more or less completely forgotten, right? You could sort of sense this was going to happen with the election of Biden, but I was kind of taken aback by how quickly all of this in fact occurred, right? And it's only sort of accelerated, obviously, over the past year. So just to sort of put things into perspective, you remember back in 2020, Democrats were very much making arguments about, being the party of science, right? Taking care of people that were being affected by the pandemic, right? There were promises made, things like back hazard pay, which never actually passed, right? Biden, he was running in 2020, mind you, he was running on the 2008 Obamacare platform of Obama, right, which originally called for a public option, right? We never got it back when Obamacare passed. And amazingly, right, it simply took a worldwide pandemic for any discussion, it seems, any discussion at all of healthcare is now totally, out of the picture. Right, it's amazing how for 2 years now, there's barely a single peep about healthcare reform. I still see people on the internet right now, on Twitter, elsewhere, begging on GoFundMe, that sort of thing. Right, people that got sick from COVID back in March 2020, before there were vaccines, before people really knew what to do, and they're still begging now. Right, many of them are disabled. Right, there hasn't been anything established for them in terms of like some kind of, some kind of like fund, right? There's just kind of like very minimal sort of investments being made. In fact, some of the key investments are being rolled back. Many of the information gathering that was going on, that's been rolled back. It wasn't as explicitly done nor as politicized as under the Trump administration. But the fact remains that some of these key things have been rolled back, right? There's, I remember there were like some data centers that I used to follow that soon after Biden's election, they were like, all right, we're now going to, after the vaccines rolled out, we're now going to wind down this, wind down that. And this is going to be a problem specifically because as COVID is starting to pass around in kind of endemic style at this point, what's bound to happen is, because COVID is a vascular disease, which means it's going to affect invisibly or visibly. And by invisibly, I don't mean there's no actual effect. I mean, much of this stuff is hard to gauge, hard to measure. For instance, I saw recently a study that indicated that 100% of long COVID sufferers, which themselves could make up as much as 10 to 25% of the population, depending on what you look at, it seems like close to 100% have clotting, right? Have some form of vascular damage. So any organ that receives blood flow is at risk. And when I call this invisible damage, what I mean is we're in a situation where we're past the acute stage of the most basic damage being death, right? Like we're past that acute stage. I originally thought after Biden came to office with 400,000 deaths under Trump's belt, all right, we're going to definitely break 1 million. Like last year, I was thinking possibly get to 2 million or higher. It does seem that has slowed down, right? We are now up to 1,070,000. So, there's a little pop quiz. How many of you actually knew that we passed the 1 million deaths threshold in America sometime in, I believe it was like March or April of this year? So we're past the stage of just acute death after death after death, right? It's become less deadly. But what we are entering is this endemic stage of coronavirus where everybody is getting infected multiple times, right? We're adding up this different kind of vascular damage. What I imagine this playing out is, if you, for example, like you were slated to have like a heart attack, let's say, in your 60s or your 70s, let's say, just sort of like both genetically as well as behaviors that, you know, you're just stuck with, because I mean, most people don't really change habits no matter what the threats are. So let's say that, just statistically speaking, you're one of these people that's not really going to change your habits, right? And you were slated to have like a heart attack for genetic and epigenetic reasons at maybe 60 or 65 or 70. This might now, go down to about, by 5 years, by 1 year, maybe a heart attack that was going to be not deadly is going to be deadly now. Maybe a stroke that wasn't going to be deadly is going to be deadly now. And it's going to be, this like death by 1,000 cuts, right? Whether it comes to nutrition, which I've studied for a while, enough to basically say that we know very little about nutrition. There is so much debate here. Like, we have such a minimal understanding of just like many functions of the human body, actually, many ways that disease works, ways that food works. COVID is no different, right? Because it took a while for many studies to start coming out, for us to start making like risk-based assessments. And one of these assessments is like starting in early 2022, studies started coming out indicating things like a large percentage of people that even have like a mild COVID infection, they experience something like a shrinking brain, right? Something like about 2% with an infection. And, maybe this is going to go up and down based on severity, based on whether or not you have long COVID, that kind of thing. But that's pretty substantial, right? A 2% shrinking of the brain is something like 10 years of aging of the brain, right? Which means that, again, if you were slated to have dementia or even Alzheimer's, you might get it earlier, or you might get it and it's going to be more severe, right? These are the kinds of things that will be very difficult to study, because, there's less and less money increasingly related to COVID. And, this is going to be a substantial issue down the road, right? We're probably going to start seeing acceleration of disabilities. I follow actually a number of various doctors on Twitter, and granted, there's, just like you saw in 2020 and 2021, a contingent of doctors that were clearly just like purely driven by ideology, right? Especially the sort of COVID deniers. People like, Simone Gold, right? I use the term doctor loosely in that scenario. And all these kind of grifters, right? All these COVID grifters that sort of started up their business essentially back then, right? When it was still kind of like a lightning rod. And I'm sure that, this breaks in the other direction, right? There might be people right now that are hysterical. The difference, of course, is that when I look at some of the Twitter discussions between these COVID-alarmed doctors, right, they're saying this should not be endemic. This is not something that we can deal with in terms of multiple infections, right, one after the other. Right? We don't have enough data to be able to say that this is safe to do. We don't have still, like Biden is in office now. We still don't have any real healthcare infrastructure in place. And in fact, most of it has been absolutely dismantled. And these doctors are arguing amongst one another, and also amongst what they term COVID minimizers, right? There's another contingent of doctors who are arguing, this is fine. This is now more or less a cold. It's more or less, a mild flu at this point. So who cares? Right, which mirrors, in this odd way, some of the arguments that Trumpists used to make in 2020. The difference now, of course, is that there is more to the argument that it's milder, right? Obviously, people will not be dying as quickly now, so there's something to be said for that. But to go fully in the direction that this is now more or less a cold, right? That is also irrational, right? That is not actually how we should be viewing this or treating this. And so when I look at these doctors, right, that might very well just be all driven by ideology, alarmism, whatever, they seem to have perfectly reasonable credentials, right? They seem to have tons of citations to their name. They don't seem to be quacks, right? They seem to be like normal people, normal doctors before this, and they decided to become activists after all of this started to transpire. And when I see the arguments that they're conducting with who they term to be doctors who are COVID minimizers, it seems to me like they're winning out on any number of fronts. Like there's any number of technical sort of little debates that these people are getting into. I mean, you could go to Twitter, you could follow it if that's interesting to you. But it does seem to me that the status quo that has emerged is one that has primarily emerged because of a change in political leadership, right? Back in 2020, right, it was obviously factually correct to blame Trump. I mean, he is responsible for doing absolutely nothing about COVID except, essentially waiting for vaccines, right? Democrats at the time said not only should we not simply wait for vaccines, even when we do get vaccinated, we need to be extremely careful afterwards. But that has gone completely out of the window at this point, right? Whatever that you might say about, Trump back then, I mean, Biden inherited this, right? And it's not so much that I believe that we suddenly have all these doctors who are willing to cover up evidence. You don't have to engage in conspiratorial thinking. You simply have to, just pay attention to how the media operates. So back in 2020, early 2021, any number of doctors would freely be allowed, right, to go on TV, right, because there would be a slot for them, right? Media would say, we're looking for this doctor, that doctor, right? We want to discuss this aspect of COVID, that aspect of COVID. So they would go on TV because the time was available for them, and they would say whatever they wanted to say about COVID. That's just generically how it worked. Now, right, with a passing interest, as a combination of people getting tired, but also political leadership from the very beginning, and I'm going to get to this, right? The first signs in early 2021 that Biden was not going to be, taking just a purely science-based approach, is going to be, explicitly a political approach, right? Their own version of political correctness, just like Trump's version of political correctness back then was COVID is just a flu, right? We had a new variety of COVID political correctness by the time Biden came in office. So now there's just no actual interest in discussing COVID, right? People are more or less done. Politically, Biden declared independence from COVID. I believe it was in coinciding with July 2021, right? So they're not, they're just not interested any longer. So if doctors, right, if there is still, a large number of doctors who are reasonably alarmed where things are going, they're simply not going to be on TV, right? It's not that anyone is explicitly hiding this, right? They're just not going to be on TV. You will not get this information. You will not get this debate, right? End of story. Now, the reason why I said that this has become explicitly political, and we saw signs that this wasn't purely going to be a scientific response from the Biden administration, early 2021, I was surprised to see how quickly the administration sort of turned from we're the party of science to doing very kind of Trumpy things, let's call them. One example was in January and February 2021, so this is months before the vaccines were rolled out, Biden was demanding, schools need to reopen, teachers need to be back for in-class instruction, which I mean, from a purely kind of technical standpoint of, whether or not kids are damaged by not being in school or not having live instruction. Obviously they were, right? And Biden understands this, Democrats understand this, and they want to get back to normal as quickly as possible. But the only thing that prevented them from, succeeding in these orders going through and people following along is the fact that, teachers rejected this. They're we're not going to go back to school without a fucking vaccine, So ultimately, the school reopenings started being, most of them coincided, at least in the blue states, right, with the fall semester of 2021. So from the very beginning, right, there were signs that this was not going to be a purely kind of scientific response. And for those that might disagree with this and say that there's a fundamental difference in approach between Biden and Trump, I would ask you, what exactly did Biden do that was different from the Trump strategy? Because this is my claim. The Trump strategy for COVID was essentially one of, we're going to wait for the vaccines, and this is going to be what saves us, right? This was the strategy that Trump had in mind, right? He wanted to reopen everything as quickly as possible. He didn't want to deal with these like goddamn hassles. He wanted to, let's say, get back to normal as quickly as he could. Biden, for his part, right? So first of all, we have that early evidence that he was trying to do this, right, in schools, right? An interesting point now is that kids, compared to 2020, right, the hospitalization of kids with COVID-related symptoms and COVID complications and all that was very small. It accelerated actually in 2021 after vaccinations and after various new variants started coming out. And it's accelerated now to its highest point in 2022, right? There's no reason for me to assume that that's going to decelerate, right? We're probably going to have similar things happening. But again, back to the point, right? We know that specifically when it comes to school reopenings, Biden was willing to not follow the science. So what exactly is the primary difference between what Trump did and what Biden did? Because we had, like with the exception, I guess, like with like some of that messaging, right? Biden was not out there saying, take these masks off, like, who gives a shit, right? He wasn't doing that, at least at the beginning. But it didn't take a very long time for even that to go out of the window. I remember like when the courts blocked like a federal order, right, to have like mask mandates on a plane, right, in airports, that kind of thing. Biden, I mean, like, okay, you can make the argument that in that specific scenario, maybe Biden can't do anything there. But when he's asked about it, right, he's a leader, right, he's a leader of Democrats. Right, people actually pay attention to messaging. I know it's not, like Democrats assume that, no, Democrats don't pay attention to messaging, while Republicans, when they're in power, wow, they rile up everybody to do anything that they want. They hypnotize them, right? But the fact is, people do pay attention to like generically messaging, right? Most people are normal. They see on TV the president saying something. They're like, all right, well, maybe there's something to it, right? That's generally how things function. Right? People that are like not chronically online, people that aren't like, insane ideologues. It's most people, right? One reason that I love walking through neighborhoods like Jamaica or neighborhoods like Jackson Heights, nobody's online over here. Nobody's on fucking YouTube. I look insane right now walking through this neighborhood with a goddamn microphone and this whole setup. Nobody's on YouTube here, right? Nobody listens to podcasts. Nobody knows anything about anything here, right? Most people here, if they were to see certain things on TV, messaging from whoever's in office, right, whether it's Trump or Biden, that's going to have some effect, right, in terms of how they behave. So when Biden was ultimately asked about this court order, he said something like, just do what you're comfortable with. If you want to wear a mask, wear a mask. If you don't, then don't. And that the bare minimum that he could do in that scenario is say, look, listen, I know what the court said, but obviously the scientific thing and the correct thing to do is wear a goddamn mask if you're going to be on a plane, if you're going to be seated with hundreds potentially of other people, all packed together in close quarters. You should be masked, right? There's no nothing has changed, right, to change that specifically, right? Even right now, right, there's no reason to go into crowded places and not be masked, right? It doesn't make any sense. But he couldn't be bothered to do that. And I remember actually around that time, I had like an argument with Dan sometime like after the vaccines rolled out, like Dan Schneider. If you look at my website, automaticnation.com, there was an article from around like the summer of 2021 that was basically arguing about COVID, right? These restrictions are too restrictive. And I think there were some good points that were raised there. By the way, the writer is Len Holman, right? He did a bunch of work last year and also part of this year for the site. Do check out his articles. And I agreed with some of the points being raised, but it was also like under a different context. Like if I could go back now and redo some of those arguments, I would. Because some of the stuff that I was arguing for was like, for instance, like I remember back in 2021, like, everybody got vaccinated or whatever. I wanted to go to my old college library, right? There was like some book that was only available there or whatever. I don't even remember what it was. And I was like, all right, I know that there are people, coming in and out of school there. It should be fine for me to go there. I didn't even bother to check. When I show up, like they didn't let me in, and I was like, well, everybody here is masked, including me. Literally everybody that's in that building is vaccinated. Why can't I, use my alumnus card to go inside the library, check out a book, and leave? That seemed kind of insane to me. Another time I was getting on a plane, I was going to Montreal. And this was in October of 2021, and they demanded that, they made some demands that I thought were reasonable, to get on the plane, be vaccinated, great, to get on the plane, you have to be masked, great, I don't care. But they also required me to have a PCR test, right, as opposed to, a standard like swab test, antigen test, whatever they're called. And that had a premium of like $250 or whatever, simply because you need to have results within 2 or 3 days at the time, but they couldn't promise results it was like a range between 1 and 5 days. So if you gamble and say, okay, I'm going to allow insurance to cover it without expediting it, you might, end up getting it 4 days later, and suddenly not only do you miss your flight, but you also paid money for nothing. So I was like, all right, I'm going to cough up this money. And I was kind of annoyed about that, right? There were some restrictions that, just generically, like if you think back, it didn't really make sense. It wouldn't have made much of a difference, right? Me stepping inside a library, mass vaccinated with everybody else's mass vaccinated, it wouldn't have mattered. But then around the time that I started making these observations, like all hell broke loose, right? There was something that happened also like in New York City, right? This was like, I date this back to the election of Eric Adams in New York City in 2021, where as soon as he got elected, like all bets were off, right? We went from a ton of like irrational restrictions to absolutely no more rules whatsoever, right? I mean, even back then, people were like a little bit starting to get, like not wearing masks when they were getting into subways and shit like that. But now, like you saw Eric Adams, right? This is what I mean about political messaging and actually like people paying attention to you. He was out there saying, without a mask, saying stuff like, does it look like I'm scared? I'm not scared. Going to parties, completely maskless. Like, this is the example that he was setting. It's bad enough that in New York City, we had an example set from, various cops that, they were all like uniformly, never ever masked, right? 2020, 2021. I remember whenever I go to Home Depot, I'd always pass by this precinct. You'd always see like a crowd of 20, 30 guys, right? Smoking, blowing smoke in each other's faces, right? All of 2020, just totally not giving a fuck, right? This is how the cops behaved. This is how they behaved in public transit, right? There was a law, like at least, they had a plausible deniability standing outside of a precinct, right? They maybe weren't breaking any laws there, although perhaps even like there was something related to groups of people congregating, right? But I mean, they would stand around there. But when they'd go on trains, right, we did technically have a law, right? The regulation is you got to be masked when you get on. But as soon as Adams started with his messaging that it doesn't matter, people weren't, following the rules in the subway any longer. Right now, for instance, taking the subway here, there were maybe 3 or 4 people that were in total in the whole cart that were masked in any way. And that's kind of like the reality, right? For all the sort of rioting that the cops did back in 2020, 2021, the one reasonable thing they could have done that they didn't do is if you see somebody breaking this kind of restriction, this kind of law, Have a mask. Like, don't even like find them or us and be like, look, here, you're on the subway with me, put on this mask and just like be like a normal, decent human being, right? That didn't happen. That's not happening now, right? All bets are off, right? And there's no actual reason to choose between total extremism on the one hand and a completely laissez-faire attitude, right? You could have some in between. There's no logical reason why there should not be a law right now in New York City saying if you get on a train or a bus, you have to be masked 100% of the time. There's no reason why we shouldn't have that, right? There's no reason why cops who are now all over the subways, like every 2 stops, the conductor says, and if you need help, this is a train stop with cops on it. They're constantly in the carts, they're constantly on the platforms. The main thing that they're doing now is they're breaking up encampments of homeless people, they're arresting them, they're fucking beating them up. People that are selling goods, they are beating them up, taking their shit. There's no reason why, with all the cops that we have on these platforms and the fact that we have a functional, New York City generally handled coronavirus very well, right? We have a functional city, we have a functional state, we have a functional nation state in America. There's no reason why these cops can't be coming up to people and telling them, if you don't have a mask, here's a mask and wear it. You can't be unmasked here, right? There's no reason why this should not be going on. There's no reason to not have a law in this regard, right? You need laws about this kind of thing. It's such a minimal sort of restriction that makes a huge difference, right? New York City has millions of people use the subway every single day in very close quarters. There's no reason why people should be going around and infecting each other. Another sort of like fascinating element to all this is how quickly the people that I would term to be COVID geeks, how quickly they sort of changed perspective, right, compared to their behavior in 2020 and 2021. Because the Democratic Party messaging at this point is one of, it's this laissez-faire thing where they keep pointing to the vaccines, right? All that they did, right, compared to Trump is they allowed the vaccines to be rolled out without incident, right? They were more or less done well. Maybe Trump would have been behind by a month given the level of incompetence in that administration. But generally speaking, right, we more or less would have had the same vaccine rollout. Got dust in my eye. Hold on a second. All right. All that Democrats did at that point was they essentially said, listen, guys, if you want to go and make an appointment at a pharmacy somewhere, do it, right? You have the right to go make a pharmacy appointment, to show up to that pharmacy and get vaccinated, right? And then we're going to have some like minimal sort of restrictions that's, pretty soon we're going to just make disappear. All right, so that's more or less what happened. But the COVID geeks that were so up in arms, right, for a year and a half or so, they started exhibiting behavior that the only thing that I would consider, maybe the only way that I could phrase it is maybe like psychopathic. To give one example, I know someone that recently spent, the past 2.5 years to not catch COVID at all, right? Got vaccinated, got boosted, blah, blah, blah. Does everything that he's supposed to do in New York City, no problems at all. Even now, wears the masks, everything he's supposed to do. He took a trip to Portugal a few weeks ago, and he texts me early on the trip like, oh shit, nobody here gives a fuck about COVID at all. Nobody's wearing any masks, nobody's doing anything. They have a high vaccination rate, but nobody has any sense of danger whatsoever. And it makes me uncomfortable being around them. And I was like, all right, that seems kind of fucked up, but I know there's a lot of places like that in the world and in Europe as well. Next day, he texts me, he tells me that he caught COVID. Him and his fiance caught COVID. And now he's in a pickle, right? Because He spent 2.5 years not catching COVID. And then he spent the past year arguing that, okay, I don't really like, some of these like laissez-faire attitude that Eric Adams has. I don't like that, but what can you do about it, right? Everybody they don't want to wear masks, they're tired. What can we possibly do? This kind of like, acquiescence to state failure, right? That you can't possibly have behaved otherwise, right? Because people are just so like, as if like we have like a fucking like open rebellion here. As if we're going to have rioting in New York City because you're asked to wear a mask on the train. Now he's in a pickle, right? Because after following the rules, suddenly he's in a place where the rules just don't exist at all. And is that really a coincidence that you catch COVID in a place where nobody gives a fuck, right? You did everything you're supposed to do, and now there's a state level failure that put you in harm's way, right? I'm gonna be very clear here. There is a mass infection policy going on, right? The mass infection policy is one of, since we can't force everybody to get vaccinated, we can't do this, we can't do that, we're just gonna allow it to become endemic. And once you catch it and see that maybe it's mild, you're gonna, you're not gonna bitch as much, right? And you're gonna sort of like go with the program at this point, right? That's more or less where we are in terms of all this. So, since this mass infection policy, which my friend denies is at all a mass infection policy, right? He doesn't want to think in those terms, right? When it comes to like nice, sort of like little liberal organizations and liberal people, right? They want to sound like good guys, right? Saying something like a mass infection policy. There's something almost a little bit Nazi-like about it, isn't there? So that's the first part, right? He gets infected, right, while on vacation. Now here's the second part. And this is where I think we could make some sort of like wider structural comments about the role of government, right? What government obligations are towards you. He's now in this bind because Portugal, as well as like, the rest of the world really, there are no rules anymore. I'm not sure if people recognize this, but there are no more rules about getting on planes or walking around if you are infected, right? If like back in 2020, you get in a lot of trouble if somebody found out that you were sick and you were not quarantining and you were just like out randomly infecting people. Now, there's no restrictions whatsoever. You could be totally sick. You could be coughing, you could be this, you could be that. And if you can walk through that plane and nobody like stops you and says, oh, by the way, you look like you're kind of coughing, right? That's like another thing. Like maybe you could like imagine like a little riot of like stewardesses like, no, like don't let this fucking guy in. Look, he looks really sick. But generally speaking, like you yourself are not obligated to do anything, right? There's no legal obligation that you have towards anyone or anything anymore. But his flight was coming up to go back to the United States. And because there's no state remediation here, right? No state level remediation. What is he going to do, right? Is he going to cancel his flight, extend like a hotel stay for like another 5 days? Is he going to like pony up literally like possibly like thousands of dollars just to not inconvenience others, knowing full well that most likely, right, the people getting on that plane probably would not do the same for him. And also, look, you could point to the rules, right? For all the people that say rules don't really matter. Well, you could point to the rules and say, nobody here is forcing me to give my status, and so I can do what I want. And this is essentially what he did. He decided to just get on the plane, which again, I'm not going to blame him because this is again, like you could talk about personal responsibility, but this is a state level failure, right? If you have no rules in place, please expect people to behave as if there are no rules, right? That's kind of like, that shouldn't be controversial to say. But he gets on the plane, and this is when we start arguing over text. And I'm like, you spent all of 2020, 21 being a COVID geek. And you're saying that nobody here cares, but you're going to be sitting next to someone on a plane don't you think they would want to know your status? Like, wouldn't they behave differently? Even if you're saying, like, because that's another thing that started, right? He would start arguing about, well, people in Portugal don't care, right? They sort of know the risk, and this is the risk that they take. I'm like, all right, well, since this is the risk that they take and they don't care, will you tell the flight attendant, by the way, I have COVID? Will you tell the people sitting next to you, by the way, I have COVID? Right? And he got very uncomfortable, he got upset. And of course the answer is no, he told no one. And he also said that as he was sitting on the plane, the woman was like taking her mask on and off and ultimately just like took it off and that was it. So I was like, all right, I don't think she would have taken off if she knew that you had COVID, but I can't blame you too much for being a hypocrite here. But I think the funniest thing of all is as he was getting back, right, because his grandmother lives with him, he didn't want to get his grandmother infected, of course. So he sent his grandmother on like a 3, 4, 5-day vacation or whatever elsewhere, very far away from him so that she couldn't get infected. And the reason why I'm telling this story is not to like shit on this guy and to like whatever. I'm just telling the story just to show you just structurally, when you talk about a structural state level failure, what does that mean in practical terms for the day-to-day person, right? Think about the fact that what I just described, this is an event and a set of decisions that millions of people all around the world are going to be making. And if there's no grooves that are greased for them, right? No carts that they could easily jump into that will take them to where they need to be, right? No state intervening on their behalf. Like New York City, what they used to do if you have COVID is they would give you a hotel room and they would bring you food for the duration of the quarantine so that you didn't have to infect anyone. That's a great fucking program, isn't it? Right? New York City, again, had a wonderful response overall to COVID, given the circumstances, given the tomfoolery going on from, up high from Trump. But, since that is all gone, what exactly is left for people to do? Like, what are they allowed to do, right? Should people be the ones making these kinds of decisions, right? I personally don't believe that, right? This is not, this is such a complex moral conundrum, right? Most people are not going to even think about it in these terms. They're not going to think about like pros and cons. They're just going to be in a situation where they're going to go with the easiest route, which is to infect people. And all the messaging around them is saying that this is more or less okay, right? Again, this guy, he's an educated person. He's very careful about COVID. He was making all these moralizing, sanctimonious arguments in 2020. And literally, when it comes to like this sort of inconvenience, totally goes out the window. And, think about the fact that the average person is far less conscientious, is far less willing to, think anything through, much less go through some decision that would be different from this guy's decision, right? It's a terrible state of affairs, right? Personal citizens, and this is like a major thing of COVID policy that I'm seeing now, pandemic responsibility should never have been outsourced to individual private actors in America, right? You and I, you could tell us, right, we should be wearing masks, we should be getting vaccinated. But beyond the should, you need a mix of incentives and sticks, right? There's nothing wrong with sticks here. New York City has a vast police force, right? Notoriously corrupt, powerful police union. These guys could, potentially act as a stick as far as incentives go. What we did was fine, right? We had the hotel rooms, right? We had, we're gonna pay money if you get COVID shots and boosters. So all that's fine. But generally speaking, like around most of the country, and even like much of Europe, right? COVID responsibility is just a matter of shaming people, right? It's all a matter of like just being punitive. Like when people say, well, what do you expect Democrats to do, right? This is unpopular. People are tired of COVID. Well, my answer is simple. everything that was related to COVID over the last few years, almost everything was just punitive, right? Most places did not give you hotel rooms if you're sick, right? Most places did not pay you money to go get vaccinated. There was no back hazard pay, right? This is a promise, right? So everything, literally every policy related to COVID just came off as punitive, right? Imagine if at the tail end of everything, right, Biden was saying things like, and you know what, because we saw how bad this all is, we're gonna revamp everything, right? I truly will become the new FDR. We're gonna have a totally new medical infrastructure. We're gonna at a minimum have the public option, right? Imagine if that was the end result, right? With people saving year after year thousands of dollars in healthcare costs. People year after year just net becoming more and more healthy because of this new infrastructure in place. People, being paid appropriately, right, to stay home where they need to be. If you have COVID, right, like even if you don't want to like keep the country shut down because you're saying the economic drawbacks are too much, we can't just stay home for 24 consecutive months, whatever, fine. But at a minimum, if you are sick with COVID, shouldn't something happen for you? Like if you do get it, right, and you're able to verify, okay, I caught COVID, shouldn't somebody like give you, I don't know, maybe like a week worth of pay, whatever it's gonna take for you to stay your ass home and behave like a normal person, right? And when I say normal, again, like it's not even so much to like put blame on the people that don't behave this way. It's more so the fact that without incentives in place, you're being made to behave this way, right? Like you're being turned into someone that's not a normal, functional human being, right? Because you're not being given any help, right? That is an issue. So that's the way that I viewed that aspect of everything specifically. And so moving on to some other elements, right? What I see in terms of like the political response and the kinds of like camps that are now being set up, right, of various like ideological stripes, right, which is becoming even more disturbing now, but now since like COVID is over, right, like nobody's really paying attention to this part. So recently back in the Atlantic in the last couple of weeks, there was this article that came out arguing for pandemic amnesty. And the thrust of this argument was, you know what, like back in 2020, we didn't actually know what was going on. We didn't know how damaging some of the policies would be. We didn't know how damaging some of the inaction would be. It wasn't arguing from like a conservative position or whatever. But, before I even get to that part, there was like a fascinating part. Although I believe she's a doctor and she works with COVID, she immediately like starts with a total like misinformation. Not disinformation, because I think she's honestly like not aware of this fact. But she said something like, back in 2020, before we had like proper masks, we were putting like bandanas and cloth masks over our faces that we now know are ineffective, right? I think she uses the word worthless or like something similar. And this is misinformation, like right from the jump, simply because although like, yes, technically, obviously some masks work better than others. And also you can make an argument that perhaps there are some category of masks that won't at all in any substantial way limit your infection, meaning like, you're just going to get infected. But obviously there's a huge difference between catching COVID, right, just generically catching it, let's say, versus catching COVID, right, of a certain kind of intensity. If you're walking around with an ineffective cloth mask or bandana, there's a difference between inhaling a single molecule of coronavirus virus versus 2, versus 1,000, versus 1,000,000, right? Imagine stepping into an entire goddamn cloud, right? That is nothing but airborne coronavirus particulates. In that scenario, you're going to get a lot sicker, all else being equal, right? You play that simulation out 1,000 times, than someone who inhales just a single particulate, right? And what even like a cloth mask would do And I'm just kind of amazed at how like deeply rooted this misinformation is. Even COVID geeks who should know better, right? They're making this argument now. Even a cloth mask that doesn't actually protect you from getting infected, it might be, you know, the difference between catching COVID with a mild infection versus catching COVID with long COVID versus catching COVID and dying, right? These are all, there's a wide spectrum of possibilities, right? Instead of worrying specifically what happens on an individual basis, imagine if people would make the same decisions that you're making 1,000 times, 100,000 times, 1,000,000 times, 100 million times, because that is the reality of what this is, right? People's bodies are different, right? How they're going to respond to all this is different. So this is an important way to think about it. But anyway, so to get that piece of misinformation out of the way, so she goes on with this, in this article, right? Okay, we need pandemic amnesty. We need to be kind to one another. We need to be forgiving one another, right? If we misspoke or misbehaved or did too much or did too little. And one thing that fascinated me is before I read the article, I couldn't, you know, like based on what people were saying on Twitter and elsewhere, everybody was trying to take credit for the arguments within, right? In the sense that pretty much everybody, whether you're a hardcore Democrat, a total like, you know, a COVID hardliner still, or somebody that is like a Nina Simone, not Nina Simone, sorry, oh my God, Nina Gold, right? No, not Nina Gold. D. Simone, oh my God, I don't even remember these like grifters' names, like Simone Gold, whatever her name is, that doctor. If you're one of these kinds of characters, they're saying no, right? We won't have a pandemic amnesty. You lied to us all of 2020, 2021. The people on the other opposite side, right, the opposite side of the ideological spectrum, they're making the same argument. Everybody's trying to take credit for this idea of pandemic amnesty only to rebut it and say there will be no amnesty. It seems as if nobody has really learned anything over the last couple of years. And in fact, if anything, it's pretty obvious that those that were COVID skeptical from the beginning, they're the ones that have won out, right? I mean, isn't that true? They did win out. If you look at the arguments online, they're all a matter of we were wrong about school closures, right? We were wrong about vaccines. And there's absolutely no reason to give up all this territory, right? All this intellectual turf. There's nothing in the last 2.5 years that proves the skeptical claims, right? At least nothing that I see, right? Even if you could point to the fact that, yes, school closures were damaging to kids, and obviously they were, right? Like teachers are dropping out now, they don't want to teach anymore, everything is too expensive, right? And they're not getting paid enough, right? This is too much to deal with. Kids are years behind emotionally, intellectually, all that is true. But even back then, I mean, we knew this wasn't good for kids. The calculation was simply one of, we don't have many studies on this yet. We know hundreds of thousands of people are dying. Sorry, you know, like we're gonna try to deal with this by not forcing kids and teachers to be in close proximity to one another, because this will be the primary vector of transmission, right? And you can make that argument now. Nothing wrong with making that argument. But in many important respects, given how quickly Biden backpedaled from all the promises, we're going to totally revolutionize healthcare. We're totally going to be the party of science. Given how quickly the media backtracked, given how quickly medical professionals were no longer given that spotlight, I'm not sure if liberals understand this, but they are very, very much in the back foot here, right? And I can imagine in the future a pandemic that ends up being more deadly, like a real pandemic that doesn't have a 1% kill rate that is primarily at the time limited to, you know, just like one specific segment of the population. A real pandemic, right, with higher transmission, higher death rate, and you could easily imagine the spreading before the people that are anti-vaxxers. Of course, eventually, if it's deadly enough, all the anti-vaxxers will be no, fuck you, I'm getting vaccinated. And if you're not getting vaccinated, I'm going to fucking kill you, right? Because you're not going to be walking around me or my family killing me, right? If it's really like that, if it's really that deadly, right, people are going to fall in line. But we've now eroded so much trust in public institutions, political institutions, that ultimately, it's not going to matter, right? We're going to have that initial upswell of damage, and everyone's going to feel at the time vindicated, right? And it's going to take a while for that to ever change. So this is kind of where we are now, right? We are at a point where state power is everywhere, all around the world. It's being challenged, right? There's some, good signs in terms of like we're not doing the same kind of austerity that we used to do in various recessions or whatever. Well, there's some good signs like that state power is reasserting itself. But when it comes to lots of other very important respects, state power is receding. Okay, there are so many private schools now that are opening up. At the same time, the public schools are closing or are being defunded. New York City has lost hundreds of millions of dollars in DOE funding with the Eric Adams budget, despite the fact that we need it more than ever, right? We need higher pay for teachers. We need to incentivize teachers to actually stay. All the people that, used to be in teaching with me, a lot of them, they're just literally last year, 2 years, they've quit, right? That's a problem. You can't keep pushing things off into the private sector. This is damaging, right? Elon Musk, he bought Twitter, right? The control of information now is in the hands of a right-winger. Already now, if you look at his pinned tweet, what is it? The world's premier environmentalist is recommending that Americans vote for Republicans, right? The world's premier environmentalist is telling everybody to vote for climate change skeptics. And what I can imagine happening actually in that dynamic is if he successfully gets more and more Republicans elected, I can imagine there being this kind of metamorphosis, right, of this dialogue where they're like, you know what? He's right. Climate change is real. But the only way that we could effectively deal with climate change is if we all invest in Elon Musk's ventures, right? Just like there's always this kind of superhero narrative when it comes to private schooling, right? Charter schools. There's going to be a superhero narrative when it comes to climate change, right? Everything is being offloaded from the public sector into the private sector, right? These are now private responsibilities, private decisions. We aren't going to have government created rails any longer. So, and in many other important respects, right? The state is simply receding. I recently read an article about the growing use of private security forces all over the world, but specifically in South Africa. Now, I was shocked to learn this, that 60% of all policing that occurs is private security forces in South Africa, right? This is totally unacceptable, right? You cannot have these groups that are going to be just definitionally, they're going to have fewer restrictions put on them. They're going to be more abusive. It's going to be the same kind of situation that we used to have in America and elsewhere, where companies or people that have wealth, they're going to be hiring private forces. And in a place like South Africa where violent crime tends to be very high, you have lots of neighborhoods, both black as well as white, but primarily this is white neighborhoods, with tons and tons of military grade compounds with military grade officers just essentially going around everywhere and protecting them, right? And I find that totally unacceptable. Let me actually see what else we have in terms of this this set of notes. So the main thing. So one thing that I noticed recently, it's happened this year, right? I was watching like a hawk. I was watching like a hawk for when the number was going to cross to 1 million deaths under Biden, right? Because I had this hypothesis: we're going to cross 1 million deaths, and we will have exactly zero substantive coverage on this fact. And if it were the other way around, right? If Trump were still in office, of course, as soon as we crossed 1 million deaths, we would have had headlines like grim milestone, right? Grim milestone, 1 million deaths. Is the state going to do anything about this? Does the Trump administration care? And I actually gave them a couple days. There was actually something that happened around the same time that we crossed 1 million, when there was like some sort of like, white nationalist shooting or whatever, right? So that took up the airspace for a little bit. But 2 days after it happened, and so like, first is like Johns Hopkins, coronavirus dashboard, plus a few other ones. So when we officially crossed 1 million, not everybody had that 1 million number, right? It took a while for everybody to sort of catch up, like a few days. So I gave them a few days, right? A couple days after that white nationalist shooting, when we crossed 1 million, the media went back to discussing total nonsense, total bullshit, right? There was like, oh, there's like some sort of like allegations of like some fucking like Republican gay orgy. They had like headline articles and like some tweet that somebody did, right? New York Times did not have frontline coverage, right? Headline coverage of the 1 million deaths. MSNBC, I like on that page for a couple of days, I didn't see anything on that page. There was like much further down you could find it. I remember actually NBC, or was it NPR? One of those two actually had it on the day of when we crossed 1 million, but it was like the 5th or 6th story down. It was definitely not top headline news. And again, if Trump were in office, this would have never occurred, right? If Trump were in office, we would have had a discussion of that 1 million number, right? You cannot tell me that wasn't a political decision on the part of the media. And when you even went to Fox News, right, they were at least consistent on this front, right? They weren't like, oh my God, 1 million deaths. Doesn't Biden care? They barely covered it as well, right? It was like another thing that was like number 10, right? And then completely passed over. So, I mean, look, these are political decisions. When people say things like, we are in fact the party of science, we're going to do this, we're going to do that, there's no trust left, right? Look at the way that this pandemic was handled. There's absolutely no trust left at this point. Everything that was supposed to happen, everything that was supposed to revolutionize, right, people's experiences, revolutionize healthcare, right? Let's have some measures that are not simply punitive, right, when it comes to the pandemic. Let's actually get something out of this, right? There needs to be ultimately something constructive that comes of it, but I don't see that. I still see people begging, right? They got long COVID. They're still out there begging online, right? There's no fund for them that's going to help them out. There's no public option that's coming out that's going to help them out. It's as if it never happened, right? We're still dealing with like inflation related to the pandemic. We still have the supply shocks. We still have issues with the economy. We still have the Xi Jinping, will he or won't he sort of scenario, right, when it comes to their zero COVID policy. But beyond that, not much is happening. And I mean, here's the thing, right? Like, we don't have to be in a situation where it's either Xi Jinping's zero COVID policy or nothing, right? There is definitely a rational in between that we are not, that we're just not taking care of. So anyway, this is the way that I see it. I think I'm going to end it here, head back home. Like I said, I was hoping to do some of those Russian poetry videos tomorrow, but I'm going to have a busy week, and I want to make sure that I get my own writing done, right, which is always, I'm always trying to make that my top priority. So, but soon, guys, soon. Thank you for watching. I'll see you guys soon.